Hi, my name is Dr. Sambataro, and I am very excited about being here. And I want to first thank Dr. Dom for putting an amazing program together. I know he spent many years and efforts in establishing something that he's feeling so true about and in his heart wants to share with other dentists so that we can all come together as a community and help more patients. So it's really exciting that he's put together an amazing curriculum and model for training dentists on how to be true biological dentists. Just a little background myself, I've been practicing 45 years, 38 of those years actually as so-called holistic dentist. I had my original training with some of the pioneers like Dr. Hal Huggins, Dr. Thomas Levy, Dr. Thomas Ralph from Paracelsus, and Dr. Dietrich Klinghardt. And, I established some foundation with them that is very difficult to shift away from that. But I've been very displeased and disheartened about the biological holistic societies out there because they are still, some of them anyway, promoting root canals as being an acceptable procedure. And I just can't resonate with that because of my training with Hal Huggins and studying Dr. Weston Price. So if I look back about 25 plus years ago, the name of my practice was the Institute for Biological Dentistry. So I was attempting to do what Dr. Dom has done. That was in my heart. I thought I could really put that together. So I was unable to do that, especially not nearly what Dr. Dom has done. So my hat off to you, Dr. Dom. Thank you for this. This is a big, big deal in the biological dentistry profession because we need some guidance and we need some kind of foundation that we can all follow so that we're all moving, in the same direction. And that's been difficult with some of these societies because they still don't fully understand cavitations, for example. And I've had these discussions. I was on the cavitation committee for the IOMT. And many of the members there felt that, cavitation surgery should only be done if someone was experiencing pain or swelling. Well, we know for those who've done cavitations, and I've been doing those for over 30 years, most of them are asymptomatic. So thank you again, Dr. Dom, for getting that message out. So I want to say I got so much out of the program, even after all these years. I think my favorite part is certainly the food design and also the bone healing protocol. Both of those I will be putting in place into my current practice. So it's just another addition to what I'm already doing, but it puts me at a different level. So even after all these years, I can still climb to a higher level, and especially when we have a community that Dr. Dom has created, so we can share each other's ideas. I feel comfortable. I feel finally I have a home where I can share my truths. So thanks again. I appreciate that. I would recommend for any dentist looking for this paradigm shift, don't hesitate. Jump on this program. There's nothing else like this, and you'll save yourself years of study. I promise you, because what Dr. Dom has put together is a nice package. It's clear, it's succinct, and it's easy to understand and follow. So you don't have to be a new pioneer. He is a pioneer in himself. I mean, I studied with some of the older pioneers, but he is the new pioneer. And it's great to have this community that you can share and learn from. So if you're new to this, jump on it. If you're a practicing holistic dentist, biological dentist, whatever your training has been, if you are true, because some of the societies are, giving people smart certification, and they're not really true biological dentists. But you can't be part of this program. Dr. Dom will not allow it unless you're going to follow true biological dentistry. So for those dentists, take this course. It's going to take your practice to another level. If you've been practicing as long as I have, so any of your old timers that are practicing biological dentistry, it will take your practice again to another level because I'm still learning. I never stop learning. So I invited Dr. Dom information. It's amazing how it's going to take my practice at already, I think, consider a pretty high level to an even higher level. So there is no bar. The bar we should continue to raise, set it higher. and move together as a community. So let's all share this together, because we can make a difference. And the main thing is not just making this amazing practice and having this curriculum and this model of education. What's the point? The point is we are helping our patients. So we have a lot of unhealthy patients, especially in the US, a lot of severe chronic diseases, and we can make a difference because where does most of that start, or where is the contribution coming from? It's coming from the mouth. So whether you have toxic metals, infections, root canals, cavitations, periodontal disease, TMJ issues, sleep issues, we are the ones that can make a difference, because without that, we can't really help these chronically ill patients. So we need to get the word out, not just to dentists, but also to all the health practitioners who are struggling with their patients to get them better, because in many cases they forgot or never knew how important it is, the oral cavity, and what an important part it plays, not just in this systemic release of toxins, but also the meridians that are attached to each tooth. They need to understand that connection. And I think as a group, we can make a difference. As an individual, very difficult. I can tell you that from my personal experience. It's been a struggle. So, Dr. Dom, again, thank you for putting this together. I am super excited about it. I'm excited about sharing this with some of my other colleagues. I want to get other people on board. So, again, I know you've put a lot of time and effort into this, and I know you're not going to slow down anytime soon. So, thank you so much.